My connections to midwifery and the issues that you're talking about today are very broad. I'm a family doctor. I spent the first decade of my medical career living and working in Niger, which is not very far from South Sudan, and very similar kinds of circumstances. At the time when we lived in Niger, Niger had the worst maternal mortality rates in the world, and I knew that 1 in 7 women that I met, 1 in 7 girls could expect to die in childbirth, which is a stunning reality. Thankfully, the rates have improved a little bit in Niger, although it unfortunately continues to face real challenges. I knew at that time that I lived in Niger and actually was witness to many births and participated in training village health workers who worked alongside traditional midwives, that a trained birth attendant at the side of a woman giving birth could reduce by half the likelihood that she would die in childbirth. So the reality of the importance of having trained birth attendants is absolutely essential. Now I'm very happy to be in the position of being Minister of Health here in Canada, and I continue to seek ways to be a champion for healthy birthing. And it's absolutely essential that for the women who are giving birth, but also, of course, for the young lives that are brought into the world, that birth experience from both the experience before birth, at the time of birth, and in those early months and years, that child gets a good start in life. And many of the issues that we're facing in this country, I know, could be addressed much better if we would make sure that people would have a healthy birth experience. So I'm very pleased that within Health Canada, we've been able to make a number of initiatives even in the past year. I'm very proud of the new investments we've made within the First Nations and Inuit Health Branch to do things like the fact that we are now supporting a policy that all women will be able to have an escort with them when they have to leave remote communities to give birth in big cities. And I don't need to tell people in the room how important it is to have someone who speaks your language and shares your culture at your side at the time of birth. We are also making new investments to support the advancement of midwifery and better birthing opportunities in remote communities in Canada. And I know that my staff, particularly Ashley, who is a trained doula, in addition to being part of my staff here, is working along with my team to make sure that we will develop a number of projects, and we look forward to working with the Canadian Association of Midwives as we look for ways that we can help people be able to give birth in their homes or communities as close as possible to the people that they love on the land that they know and surrounded by the language and culture that they understand. So thank you for what you are doing. Thank you in particular for this work in South Sudan. You will hear from Justine the huge challenges that he and his colleagues are facing in South Sudan to be able to promote healthy birthing in conflict zones in particular, and he will be able to speak to that more eloquently than I. But I want to say thank you for all of you who are investing of your time and energy, your skills and expertise to be able to support healthy birthing around the world, and it will be our honor to continue to partner with you. Thank you.